All right, welcome back to the deep dive. Today, we're going to be talking about something super practical. For anyone out there who is either a certified nursing assistant or thinking about becoming one.
Absolutely a CNA.
Yeah, exactly. And we're going to be focusing on the top 10 must-have skills that, can really help you succeed in this role.
That's right.
So whether you're just starting out or you've been doing this for a while, we're going to kind of try to distill, what makes a CNA not just good, but truly great. Like what are those things that really make someone stand out?
Yeah. What takes you from good to exceptional?
Yeah, exactly. Exceptional. And we're going to be drawing from some, pretty interesting discussions and resources that are out there. But really the goal is to, beyond just listing the skills, we're going to try to give you like a deeper understanding of why they matter and how they actually play out in the real world, when you're actually doing the job.
Yeah, I think that's key because it's one thing to have, a textbook list of skills, but it's another thing to actually be able to apply them and understand how they work in the day-to-day.
Yeah, totally. So think of this as, like a shortcut or like a cheat sheet to understanding, what separates those who are really good at this from those who are just, okay.
Right.
So let's jump right into it. And the first skill that we want to talk about is something that really underpins everything a CNA does, and that's communication.
It is. Yeah, communication is so important.
And, I feel like it might seem kind of obvious at first.
It does.
Like, of course you have to communicate as a CNA, but when you really start to think about it, you realize just how much communication is happening, like, all day long.
Right.
Yeah, you're talking to patients, many of whom might be scared, confused, not feeling well. You're talking to families who are often, worried, anxious, they're concerned about their loved one. And then you've got the whole healthcare team, the nurses, the doctors, everybody you have to communicate with.
Yeah. It's a lot of different people you have to connect with.
So many different people. And it's not just, like relaying information. It's about doing it in a way that, builds trust and understanding, right?
Exactly. Yeah, it's about creating that connection.
Yeah. Imagine, you have a patient who is, let's say, they're scheduled for a procedure and they're really nervous about it.
Yeah, that's a common scenario.
So nervous. And, a CNA who can explain what's going to happen in a way that's clear, reassuring, that can make such a huge difference for that patient's experience.
Absolutely. It can really ease their anxiety.
Yeah. And then on the flip side, you've also got those really critical tasks like reporting vital signs to the nurse or, noticing a change in a patient's condition and having to communicate that accurately and quickly.
Right. That's where, clarity and conciseness are crucial.
Oh, absolutely.
Because every second counts in those situations.
Yeah. And it's not just about speaking clearly, right?
Yeah.
It's a two-way street. Like being a good listener is just as important.
Oh, definitely. Active listening is so important.
Yeah. And sometimes, patients might not come right out and say what's
say that.
bothering them.
Right.
Yeah, they might be expressing their needs or their concerns in more subtle ways. And a CNA who's really attuned to those cues, who can kind of read between the lines, that's when you start to provide really holistic care. You're seeing the whole person.
Yeah. You're picking up on those nonverbal cues too.
Yeah. Exactly. And, you might have a patient who, keeps saying, "Oh, I'm just tired," but maybe what they're actually experiencing is shortness of breath. You know what I mean?
Right. That's a good example of how, something seemingly simple could actually be a sign of something more serious.
Yeah. And if you're not really listening, if you're not paying attention, you might miss that.
Absolutely. And that's why active listening is so important.
So crucial. And, when we talk about communication, I think it's also important to remember that it's the foundation for good teamwork. Right.
It is. It's how the whole team functions effectively.
Yeah. When you can communicate clearly and openly with your colleagues, it reduces misunderstandings, it helps prevent errors, and ultimately it leads to better outcomes for the patient, right? Everybody's on the same page.
Exactly. It creates a more cohesive environment where everyone can work together effectively.
Yeah. It's huge. All right. So moving on to our second skill. And this is, it might sound like more of a personality trait, but it's absolutely essential and it can be developed. And that's empathy and compassion.
Yeah. These are like the heart of being a good CNA.
The heart of it. Yeah. Because, as a CNA, you're working with people who are in some of the most vulnerable moments of their lives, right?
They're often facing difficult challenges.
They could be in pain, they could be feeling isolated, they might be dealing with some really serious health issues.
Yeah, and it's your job to meet them where they are and
Mhm.
provide that support.
Yeah, and that's where empathy comes in. It's not just about, completing the tasks on your list.
It's not just checking boxes.
No, it's about connecting with that person as a human being.
Right. Recognizing their humanity.
Yeah, picture a patient who's feeling really down, they're unmotivated. An empathetic CNA might take a few extra minutes just to sit with them, to listen to how they're feeling, offer some words of encouragement rather than just, focusing on their physical needs.
Absolutely. It's those little moments of connection that can make such a big difference.
They really do. And, sometimes just acknowledging someone's feelings can make a huge impact on their emotional well-being and even on their willingness to participate in their own, right?
Right. They feel heard and understood,
Yeah.
and that makes a difference.
Yeah. And it's about seeing the world from their perspective.
Like putting yourself in their shoes.
Yeah. Understanding their fears, their anxieties, and responding in a way that acknowledges their dignity and their humanity. It's those things that really elevate this role beyond just the technical aspects of caregiving.
Absolutely. It's what makes it a truly human-centered profession.
Yeah. And I think, from a practical standpoint, demonstrating empathy can actually make your job easier,
It can.
you know, because when patients feel understood and cared for, they tend to be more cooperative. They're less anxious.
Right. They're more likely to trust you and follow
Yeah.
your guidance.
So it can actually lead to smoother interactions and, help them follow their care plans better.
It's a win-win situation for everyone involved.
Totally, totally. Okay, so moving on to our third skill, and this one is really important, especially given the physical demands of this job, and that is physical stamina.
Yeah. You got to be able to keep up,
You've
right?
got to be able to keep up. You're on your feet a lot.
Long shifts.
Long shifts, you're assisting with patient transfers, repositioning people in bed, and sometimes, you're lifting patients who need help moving.
Yeah. It's a physically demanding job for sure.
And I think it's so important to recognize that your physical well-being is essential to providing good care.
Absolutely.
Yeah.
You can't pour from an empty cup,
Sure.
right?
Yeah. If you are exhausted, if you are physically depleted, it's just so much harder to stay focused, to have the energy to, do your job safely and effectively.
Right. You're more prone to errors and injuries if you're not taking care of yourself.
Absolutely. Think about it, if you're trying to help a patient who has mobility issues and you're already wiped out physically, the potential for something to go wrong it goes up.
Yeah. You have to be physically and mentally present to provide safe and effective care.
So taking care of yourself, eating right, getting enough rest, maybe even incorporating some exercise into your routine, that's not a luxury. That is a key part of being a good CNA.
It is an investment in yourself and your ability to care for others.
Exactly, exactly. And, I think it's worth emphasizing, too, the importance of proper body mechanics.
Oh, absolutely.
Using the right techniques for lifting, for transferring patients, that can prevent so many injuries.
Not just for you, but for the patient as well.
Both for you and for the patient, exactly. So it's not just about, powering through. It's about working smarter and taking care of yourself so you can be there for your patients.
It's about sustainability in the role.
All right, moving on to skill number 4. This one is all about those little things, those details, and that's attention to detail.
Yeah, those details matter big time.
They really do. And in healthcare, sometimes those small details can have huge consequences.
They can be life-saving, even.
Yeah. So we're talking about things like, noticing a subtle shift in a patient's mood, maybe their behavior is a little different, or, a change in their skin condition.
Or even just slight fluctuations in their vital signs.
Yeah. Things that maybe, to someone else might seem minor, but they could be an early sign that something's not right.
Absolutely. They could be red flags that need further investigation.
Yeah, and as a CNA, you often have the most direct contact with patients, right?
Right. You're their eyes and ears in many ways.
You're seeing them, on a regular basis. You're the one who's helping them with their daily routines. So you're in a unique position to pick up on those early warning signs.
You're the one who's really seeing the day-to-day changes.
Yeah. Imagine, you notice a little redness on a patient's heel that wasn't there the day before. That seems like a small thing.
It does, but
if you alert the nursing staff, that could lead to early intervention and prevent a much more serious pressure ulcer from developing.
right. It's about catching those things early before they become big problems.
Your presence, your observation skills, they are so valuable.
You're an integral part of the care team.
Yeah, so it's about being present, it's about paying attention, understanding what's normal for each patient, and recognizing when something's off.
Yeah. You're like a detective in a way, looking for clues.
Yeah, you're looking for those clues, and that can make such a difference in their outcome and their, how well they recover.
Absolutely. It's all about preventative care.
And this attention to detail, it's not just about the patients, right? It's about how you document the care you're providing, how you record vital signs, how carefully you follow protocols and procedures.
Right. Those details matter too.
All of those things contribute to continuity of care, make sure everyone's on the same page.
It's about accuracy and consistency.
Yeah. Okay, let's move on to skill number 5, and this is a big one in healthcare. It's teamwork.
You can't do it alone, that's for sure.
No, you can't. Healthcare is a collaborative effort.
Right.
It takes a village.
It takes a village. And as a CNA, you're a crucial part of that team.
You're a vital link in the chain.
You're working with nurses, doctors, therapists, dietitians, so many different people.
The list goes on.
Yeah, and it's about understanding how everyone's roles fit together.
Right. Everyone has a part to play.
Yeah. The information that you gather, firsthand from the patient, that directly informs the assessments and the treatment plans that other team members are putting together. Right. You're providing valuable insights from the front lines.
Yeah. And being a reliable team member, being someone who's communicative, who's supportive, that makes you such a valuable asset.
It makes the whole team function more smoothly.
Imagine, a patient complains of pain. If you can relay that to the nurse promptly, that allows them to, provide pain management interventions quickly.
Right. It ensures timely and appropriate care.
Yeah. So a team that works well together, that's when you get the best possible care for the patient.
Absolutely. It's a synergistic effect.
And, part of being a good team player is being willing to help out your colleagues when they need it.
Right. Being there to support each other.
Communicating clearly and respectfully, about patient needs and concerns, understanding your role within that bigger care plan, it all contributes.
And it's about mutual respect and shared goals.
Exactly, exactly. And sometimes, being a good team player also means advocating for your patients.
Right. Speaking up when you have concerns.
If you notice something, if you have a suggestion, being able to communicate that clearly to the team, that's important.
It shows that you're invested in their well-being.
All right, moving on to skill number 6, and this one is something that I think anyone who's worked in healthcare can relate to, and that is time management.
Oh, yeah. Time is always of the essence.
It really is. And, as a CNA, you're often juggling multiple patients, each with their own needs, their own schedules. You've got medications to administer. You've got care requirements. And it can feel like there are never enough hours in the day.
It can be a juggling act, for sure.
It really can. So being able to manage your time effectively is so important.
It's essential for staying on top of everything.
And a big part of that is prioritization,
Right.
right? Figuring out which tasks are the most urgent, which ones need to be addressed first.
Right. You have to triage your responsibilities.
Exactly. And then you also need to be able to multitask safely and efficiently without compromising the quality of care.
It's a delicate balance.
It is. So, maybe you can help one patient with their meal while keeping an eye on another patient who's at risk of falling.
Right. Being able to manage multiple things at once.
It's about having those systems in place. Maybe you create a workflow for yourself. You use checklists to make sure you're not forgetting anything. You stay organized. All of those things can make a huge difference.
They help you stay on track and reduce stress.
Exactly. Exactly. And, I think it's also really important to be realistic about what you can accomplish in a given time frame.
Right. You can't do everything at once.
If you're feeling overwhelmed, if you think you're not going to be able to get everything done, communicate that to your nurse, to your supervisor.
Right. It's better to ask for help than to let things slip through the cracks.
Absolutely. Okay, so let's move on to skill number 7. And this is knowledge of basic medical terminology.
Now, you don't have to be a doctor, but
You don't have to be a doctor, but it definitely helps to understand the lingo, right?
it makes things so much easier.
It does. And, when you have a basic understanding of common medical terms, it streamlines your work. It improves communication with the rest of the healthcare team.
Right. Everyone's speaking the same language.
Exactly. So, when you're looking at patient charts, when you're documenting the care you've provided, when you're recording vital signs, Using the correct terminology just makes everything clearer.
It reduces the risk of misunderstandings and errors.
Yeah. So, for example, knowing the difference between hypertension and hypotension, that's crucial when you're reporting blood pressure readings.
Right. It's important to know what those terms mean.
Yeah. And it allows you to understand instructions quickly. You can contribute more effectively to discussions about patient care. It just makes everything smoother.
You're more confident and competent in your role.
Yeah, exactly. And it helps you understand the bigger picture, right? You're not just doing isolated tasks, you're understanding the context behind them.
Right. You see how your work fits into the overall care plan.
Okay, moving on to skill number 8. And this one is absolutely essential in healthcare, especially these days. And that is infection control and hygiene practices.
Yeah. Cleanliness is next to godliness, right?
Yeah, especially in a healthcare setting. And as a CNA, you are on the front lines of preventing the spread of infection.
Right. You're protecting yourself, your patients, and your colleagues.
You're protecting everyone. And it's so important to understand how to apply those infection control principles in practice.
It's not just theory. It's about putting it into action.
Yeah, hand hygiene is non-negotiable. You got to know how to wash your hands properly, when to wash your hands, all of that.
It's the most basic but most effective way to prevent infection.
And then you've got PPE, using gloves, masks, gowns appropriately. That's also important.
Right. Knowing when and how to use those protective barriers.
And following those established protocols, it's not just, some rule book. It's about keeping people safe.
It's about minimizing risk and creating a safe environment for everyone.
Yeah. And, you have to be vigilant about it. Be aware of potential risks, contaminated surfaces, improper disposal of medical waste, things like that. And take action when you see something that's not right.
Right. Be proactive and speak up if you
Yeah.
see something that could be a hazard.
Yeah, okay. So let's talk about skill number 9. And this one is all about being able to think on your feet. And that is problem-solving skills.
Yeah. Because things don't always go according to plan.
They don't. Healthcare is unpredictable.
You have to be adaptable.
You do. Unexpected situations happen all the time. A patient's condition could change suddenly. You might have multiple patients needing help at the same time. Equipment could malfunction. Things happen.
Right. And you have to be able to handle it.
And what's so valuable is being able to remain calm in those situations.
Right. Don't panic.
Think clearly under pressure.
Assess the situation.
So you assess the situation, you figure out what needs to be done first, what are the priorities, and then you take action within your scope of practice.
Right. Knowing what you can handle and when you need to call for help.
Yeah. So imagine, you have a patient who suddenly becomes agitated. A CNA who is a good problem solver might try to figure out what's causing the agitation, maybe try some de-escalation techniques, and at the same time, alert the nurse.
Right. You're managing the situation while also seeking additional support.
It's about being resourceful. It's about adapting.
Being able to think on your feet and find solutions.
And sometimes it's about knowing when a situation is beyond your expertise and knowing when to ask for help.
Right. It's about knowing your limits and not being afraid to ask for assistance.
And finally, our 10th skill, and this one is about taking care of yourself so you can take care of others, and that is emotional resilience.
Yeah. This is a tough one, but so important.
It is. This job is so rewarding, but it can also be emotionally challenging.
Right. You see a lot of difficult things.
You do. You might
Yeah.
see patients in pain. You might experience loss. You might be in situations that are just emotionally draining.
And it takes a toll.
And it's important to acknowledge that, it's okay to feel those things. It's normal.
It doesn't make you any less of a caregiver.
But you have to find ways to cope, to take care of your own mental and emotional health.
Right. You have to have healthy outlets for your emotions.
Because you will see difficult things, but you'll also witness incredible moments of strength, of healing, of recovery. And finding that balance, remember just the positive impact you have, that's crucial.
It's about finding the silver linings and focusing on the good you're doing.
And it's about knowing that you're not alone.
Right. You have a support system.
Your colleagues, your supervisors, there are mental health professionals. Don't be afraid to reach out for help when you need it.
It's a sign of strength, not weakness.
Exactly.
Yeah.
Okay, so there you have it. The 10 essential skills for success as a CNA. Communication, empathy, and compassion, physical stamina, attention to detail, teamwork, time management, knowledge of basic medical terminology, infection control and hygiene practices, problem-solving skills, and emotional resilience.
It's a pretty comprehensive list.
It is, and, these are not things you're just born with.
Right. They're skills that can be learned and developed
You can work on them, you can strengthen them, you can refine them through practice and experience and self-reflection.
through continued education and training.
Absolutely. So whether you are, out there doing this job every day or you're just starting to think about becoming a CNA, we encourage you to really focus on those areas.
It's an investment in your career and in the quality of care you provide.
Any effort you put into developing these skills will make you a better caregiver.
And it will benefit your patients in countless ways.
It will. And so, to wrap things up, I want to leave you with this thought. Think about those 10 skills. Which ones do you feel like come most naturally to you? And which ones might you need to focus on a little bit more?
It's a good exercise in self-reflection.
It is. And, there's always room for growth.
Absolutely. There's always something new to learn and ways to improve.
So keep learning, keep growing, and keep striving to provide the best possible care to your patients. That's what it's all about.
That's the heart of being a CNA.
It is.
Yeah.
Okay. Well, thanks for joining us today on the Deep Dive.
Thanks for having me.
And we will see you next time.
See you next time.